So we were dealing with cochlea. As I told, cochlea, you start from above or below, whichever you prefer. You form the cross-like thing. This means we have reached the top of cochlea. It is the superiormost part of cochlea, or the dome of cochlea. You have the modulus, or you can see the internal auditory meatus from which the nerve is coming into it. It means it is the dome of cochlea. So then you go down, then you can see this kind of a structure. That means it is a 1.5 turn of cochlea, or almost in the middle of cochlea. Then if you follow this, you can see there is a projection. This means this is the cochlear promontory, or this is the basal turn of cochlea. It is almost at the level of the seal, which I have told previously. So that is about cochlea. Then you will have to see about internal auditory canal. Internal auditory canal is easier. You can see this is the internal auditory canal, which carries the 7th and 8th now. And vestibular aqueduct we have dealt earlier. So, and the additional information you have to see will be that of facial nerve, which is easier to start from here. So facial nerve, as you know, it has got an intracranial part where it is arising from bones. Then it will go into the meatus. Then it will go up. It will have a labyrinthine part. Then it will take a turn, first genu. Then goes and form the tympanic segment, where it is close to the up to the pyramidal eminence. Then it has got a mastoid part, and then it goes out in the form through the stylomastoid foramen. So I'll just come into the anatomy, or we can see this is the internal auditory canal. You can see the facial nerve exiting, or you cannot see, but you can see the canal. So where you can see this is the turn it takes. So this is the first genu. So this is the meatal segment up to the first genu. From the meatus to this short segment is called labyrinthine segment. Then after taking the first genu, this genu you have the geniculate ganglion. From this geniculate ganglion, then you go down. As I told, there is the Okay, so here you have the pyramidal eminence. So the facial nerve, after going, you can track the facial nerve up to the pyramidal eminence. At the level of pyramidal eminence, you call it as tympanic segments, as it is close to the middle ear or in the middle ear. And then from the pyramidal eminence, then you can still track it. You can still track it is going into the mastoid here. Mastoid segment. It is called the mastoid segment, and it goes out of the stylomastoid foramen. So you have the meatal segment, labyrinthine segment, first geniculate ganglion, then it goes tympanic segment, then forms the mastoid segment. So that is the order. Then you can see some important sections to make you remember. This might be a repetition. Almost all things are being done. Major parts are being done. So just to repeat and reconsolidate the major part. So the ice cream cone. At this section, another thing you can see is so many things happens at the level of ice cream cone. So many parts takes place. So one is the, as I told, you can see the malleus, head of malleus, the short prosophagus, as I told. This is the mastoid, and you can see multiple air cells. The largest one is mastoid antrum, and at the level of ice cream cone, you can see the connection between these two. It is known as the adductus antrum. Edictus to the antrum. So basically it is antrum, so there is an opening, so it is edictus antrum, and you can see the joint, all those things. And at the level of this is the, I would like to call this as ghost, two ghost, or this will be a lower level, hypotympanum. Or at this level you can also see, if you can adjust little bit, you can see the seal. So seal, this is the seal at the level of the hypotympanum. And wait for a minute, I'm trying to get the picture. Okay, this is the same image which is marked. You can see this one is the eustachian tube, and the other part is the tensor tympani. And lower down you can see there is the sinus tympani, and the you have got the facial recesses posteriorly. In between you have the tympanic pyramid. So you have the facial nerve going through it, side to it. So you can see one of the images. So you have the eustachian tube, this one anteriorly, posteriorly you have the tensor tympani, eustachian tube, tensor tympani. Here you have sinus tympani, facial recess in between the pyramidal pyramid, called the tympanic pyramid, Then you have the facial recess, all those things. So in the actual image you can see the seal is being formed. This is the eustachian tube, this is the tensor tympani. When you adjust, this is the facial recess, tympanic pyramid in between this part, and this is the sinus tympani. Much more clear in this sinus tympani. Okay, so that is there. That happens around the hypotympanum level, almost at the level of hypo. Then anything lateral semicircular canal we have told. Repeating one more time. And you can take this section almost at the level of the ice cream cone. So this larger part is the vestibule. This is the lateral semicircular canal, and also then you try to go up, you can see the superior semicircular canal. When you try to go posterior, you can see the posterior semicircular canal. This is the vestibular aqueduct. So that is all about semicircular canal. Cochlea we have already dealt, aqueduct we have done, vestibular aqueduct we have dealt. Widening is very important in case of sensory neural hearing loss. That is one of the most common cause. Following first cause is of course acoustic neuron. Then facial nerve we have dealt. Okay, then you can just complete this with coronal sections where something is important. So coronal sections, you can see the external auditory canal. You can partly see by adjusting the window, not clear in this image, the tympanic membrane. Then you can, this is the part which is important. This is known as scutum, and this is the first thing to be eroded in cholesteatoma. And this is Prusac space, which is also very important in cholesteatoma when it is involved. Something which is very easier to be adjusted and seen is the tegment tympani. This is the thin top bone which separates from the rest of the brain. So tegment tympani, if it is dehiscent, should be reported. It is easier to see in coronal images. Also in axial sections it can be seen. As I told, we need to go up. So this is ice cream cone. We are going up, we are seeing air. So this is upper part. So this part is tegment tympani. Okay. oval, even in the coronal, something more you can see is the maybe some part of oval window you can see clearly in coronal images. Just complete it by looking at the mastoid to see for any hair cells, soft tissue involving any mastoiditis or any erosion of this, and also complete by looking at the rest of the brain parenchyma to see any obvious lesion. Hope it was useful. It's my first attempt. Let me see how I hope. Only thing was to see that this complex topic become little more easier.